So it depends on what the pharmacist and where the pharmacist works, so what their role is and what they do. So if they work at the hospital and they were part of the team that discharged the patient versus if they're the community pharmacist. So I think an extended role of the pharmacist that works in the hospital that was part of that discharge team could be to follow up with the patient. So I think it's probably pretty important that they call within a couple of days, because once the patients had a chance to go home and just contemplate everything that happened and all the changes, just to make sure the changes that were discussed were able to be implemented, or if not, help them, or even call a week or two into it to see how the patient's doing if they've made their follow-up appointments. In terms of the community pharmacist, the role that they can play after discharge is really working with the patient, because even though they may have gotten a lot of information at discharge, and hopefully they did, but regardless, a lot of times, once you come home, it's just a different environment. You've just been told a lot of different things, and it's hard to know what was important, or just remember, or how to now fit it into the life that you live every day, not just when you're in the hospital. So the community pharmacist can really work with the patient to once again re-educate, see what their access is like to the medications, and then just discuss follow-up. So even if they're not the ones that are going to be monitoring the labs, et cetera, to teach the patient how to go about doing that and who to follow up with.